Good afternoon, and thank you for inviting me to your conference today and this afternoon. Part of my goal today was hoping to try to give you some additional information so that you can be better armed to communicate with the school system and to better represent your child within the schools and to know what your options are. There are two very strong laws that give parents with students with disabilities or challenges rights within the public school system or even many of the private schools, and that's the IDEA, which is the Individuals with Disabilities Education Act, and most recently revised in 2004, and then Section 504, which is from the Rehabilitation Act of 1973. And so as parents, if you know that your student has special needs because of their health issues or because of learning problems or because of a combination, I hope that you can be better able to communicate with the school system and to communicate what your concerns are and to access the services that should be available to you throughout the country. And I'm most familiar with the school systems within Florida. I've worked in 3 different counties within Florida, most recently within the Orange County Public School System, and I've been in private practice for about 20 years as well. I'm providing a handout. I hope there's enough to go around that just kind of outlines some of the current laws, so you have that as a basis to refer to in the future as to what your rights are and what your students' privileges are. And basically, each child has a right to a free and appropriate education. And if your student has special needs, it could be addressed under the Individuals with Disabilities Education Act, or IDEA, which is a federal law that requires local school districts to identify and provide free education services to students with disabilities. And most often it's implemented between the ages of 3 and 21, but there's even an earlier age window that you can access prior to that if there's a disability that's been identified, and that's part of the process. And each student who's eligible for an IDEA usually is identified as a special education student, and then those students each have an individual educational plan, or IEP. And IEP can be your guideline to communicate what the student's needs are, what program should be implemented for your child, and to maybe better hold the school accountable for instructional intervention health services for each of your students. Within each of the IEPs, several of the components are evaluation, curriculum, and placement. And within IDEA, it guarantees free appropriate education for students with disabilities, least restrictive environment, so the goal is to have students with regular students whenever possible, and if not, to have an appropriate level of instructional or accommodation services that would be most appropriate for your child. And you as parents are very much involved with that negotiation and decision-making process because you're part of the IEP team. So if there's something that's proposed that you do not feel comfortable with or do not agree with, you don't have to agree, and you can express your concerns, or you can postpone giving consent if you have any questions at all about what the school is proposing. Also within the IDEA is supplemental aids and services, assessment services, and part of the implied and legal ramifications is there's procedural safeguards for each child who's identified with a disability. Programs that usually fall under special education, my co-presenter, I think, is coordinating all those services, typically are developmentally delayed for students who have been identified 3 to age 6, specific learning disabilities, physically impaired, other health impaired, intellectually impaired, autistic, other health impaired, hospital homebound, emotionally handicapped. And that's a lot of technical labels that the school system has quantified, and somebody like myself or an exceptional ed coordinator or specialist could help you as a parent identify whether your student meets those guidelines and what those needs are and what the eligibility requirements are. Once a student's been identified for an exceptional ed program, it sort of opens the door for any level of service, because once that door has been opened and the student's been identified as having a learning disability, for example, or a physical impairment, then you as a parent also have the right to request any educational services that are appropriate for that student. So it doesn't have to be limited to what the evaluation results indicated or what the program label or title is. And there's a wide variety of, and the way it's implemented is very different from school to school and from state to state, but the federal guidelines and laws are consistent, and you do have those rights. If you feel like you're not receiving enough services for your child, you can always request to re-meet, have a staffing, an exceptional education meeting, and request more or request a reevaluation. And the next program that I wanted to talk about briefly, and these are just meant as overviews so that you know you can reference and further look up on your own time some of the rights that your child might have, is most often referred to as Section 504, and it's from the Rehabilitation Act of 1973. And basically it guarantees that a child with a disability has equal access to education and at a comparable level to students who do not have a disability. And the ease of getting in to a 504 program or having a 504 plan is usually a little bit looser, a little bit easier than an exceptional education or a special education process. And sometimes a student might not qualify for a special education program, but may very well qualify for a 504 plan. And the 504 plan can be as simple as providing extended time when the student takes classroom test or standardized state test, or even at an older level when they're taking the SAT or the ACT, or maybe sitting in front of the classroom, or it could be much more involved with some instructional activities provided as well. A child with a disability is one who has a physical or mental impairment that substantially limits major life activities. That interpretation, at least in Orange County, Florida, is sort of interpreted in an inconsistent manner, I think, from school to school and location to location. Some schools, as long as you have some documentation that the student's been diagnosed with a disability by a psychologist, a pediatrician, or a medical doctor, or even has been thought to have a disability in the past, sometimes that can open the door for a 504 plan. Other schools require more documentation for a substantial limitation within the academic achievement area. A 504 plan should include things like accommodations, and what those accommodations are. It might be to have the instructional information presented in a different manner. It might be having the students sit in front of the classroom. It might be extended time when they take tests. It might be spending more time with a student buddy or tutor or a special teacher in the classroom. The name of the person who's responsible for ensuring that the plan is implemented should be on the plan itself. The plan should be distributed to classrooms, to students' teachers, and any staff members that are working with him or her, and a copy should be filed, and it probably should be revised yearly and annually. And as a parent, my suggestion would be to have a meeting with the school staff that's working with your child at the beginning of each year, just to let them know that a 504 plan is in place. This is what we did last year, and this is what I would like to have done differently for this upcoming year. So they are knowledgeable. Sometimes a piece of paper gets put into a cume folder, and teachers that are working with your child may not be aware that there's even a 504 plan in existence. Typically, a 504 plan or disability might be related to a medical condition, a heart defect, fatigue, attention issues, ADHD diagnosis, memory, anxiety, depression, learning disability, dyslexic, vision, hearing, and I know many of those problems can often be related to heart conditions, and where you draw that line sometimes I know would be very difficult, but I think the important part to be able to document that there's a weakness within an academic area, the cause of that weakness isn't quite so important for educational purposes, and then to move forward and to know what your rights are. And lastly, I just want to review some of the some common sense strategies, that how important it is to let your teachers know what your students and child's needs are, the past history of their heart condition, their medical problems, how that's affected them in the past, what their current needs are. I think a good educator doesn't need a special education program or a 504 plan, but should be willing to do things on their own in conjunction with a knowledgeable parent to help that student be successful in the classroom. And that's the best case of all, that's the best scenario. And sometimes a 504 plan helps put teeth into that process, and sometimes a special education placement can provide some additional instructional strategies to go along with the assistance that the student needs. But let your teacher know what the restrictions are, medications, what they can do and what they can't do, and what your hope for this upcoming year would be. And again, I want to stress that with the knowledge, with you as a parent having the knowledge to access the school system, I think in a appropriate and productive way would be your best benefit to help your child. And the types of services that I typically provide are in the evaluation, support services, counseling realm. And so typically if a parent has lots of documentation, they just want to know what their options are within the school system, I might have an hour session with them and consult and review the information they have here, what the child's strengths and weaknesses are, and maybe give them some assistance to navigate the school system. In some cases, there may not be enough information. I might, if the parent is interested, might be able to provide a full evaluation such as academic achievement, IQ, attention, cognitive, emotional, and the combination, it varies depending on what that student's needs are and what the age of the child is. And based on the evaluation results, a psychologist can identify whether there is a disability or whether there is not a disability, the child's strengths, weaknesses, but more importantly, to help the parent navigate, again, through the school system. And if there is an evaluation done outside the school, then you as a parent always have the right to share that information with the school or not. It's totally at your prerogative. And sometimes parents just want to know what's my child's academic level now compared to other students, their age or grade level. And oftentimes that gives them additional information to put maybe some private tutoring in place to give that child some additional assistance. In some cases, there might be an issue with anxiety or fears or self-confidence that can be helped by an ongoing counseling program, either in the schools or outside the schools. And that's all I had for a formal presentation. I'd be glad to entertain questions after